A Tri-Valley hospital hosts a medical first for California, one that has those suffering from back pain bending over backwards to get it. In Pleasanton, I'm Christy Schmaltz. I'll have that report.
Your local news starts now with Tom Morrison, Mariella David, and Ian Bartholomew on sports. From CTV, Tri-Valley Community Television, the award-winning 580-680 News.
Two Pleasanton surgeons are performing a California first today using the latest in biotechnology to help out those with lower back pain. 580-680 reporter Christy Schmaltz has this report.
More than 250,000 Americans require surgery every year for chronic lower back pain. Called spinal degenerative disc disease, it's when the cartilage between the vertebrae wears away enough that two bones rub together, causing great pain. To fix the problem in the past, surgeons performed what is called spinal fusion by fusing the bones together. The procedure requires two surgeries, one to harvest bone chips from the hip and another to place the chips between the vertebrae, fusing the vertebrae together, similar to the way a broken bone heals. According to doctors, patients often complained of pain.
We do know that with our laparoscopic experience, we've always taken bone, and the biggest complaint the patient has the next morning is that their hip really hurts, and when they get up and try to walk, that's where their pain's coming from. It delays their recovery. It makes them require more pain medication. They get more side effects of that. It keeps them in the hospital longer.
Valley Care spine surgeons Joseph Grant and Kevin Booth are hoping to eliminate this pain by using the newest in biotechnology. Recently, FDA approved infused bone morphogenetic protein, or infused BMP, eliminates the need for bone chip harvesting from the hip. Genetically engineered and using a minimally invasive technique, BMP replaces the bone chips and virtually does the same job faster and less painful.
The main advantages of this procedure over the conventional way that we've been doing it for a number of years are that we no longer have to harvest the bone graft in order to achieve a solid fusion. So there's no separate incision from the hip, no painful bone graft harvest site. And that eliminates a significant amount of time in the hospital as well as speeds up the patient's recovery. And a secondary advantage is the fact that this molecule stimulates a faster rate of fusion so that we achieve a fusion in a matter of 3 months typically instead of more like 6 months or 9 months previously. So a faster recovery and a faster fusion and less pain.
And these advantages are setting Valley Care Hospital above the rest.
It's one of those things that is one of the newest technologies for the patients, at least in the comfort of not having to have the second part of the surgery, which is the hip surgery to take the bone out. The pain and recuperation for that has been pretty intense. So this particular way of doing it with this new infusion bone kind of service allows them to not have that. The other thing is that because we're using it and doing it laparoscopically, we also are using the smaller incisions, and the recovery time and the bloodless surgery and those types of things are part of this as well. And the patients now have another procedure that's done right here in the Valley.
The cost? Less than 2 surgeries, and according to hospital administrators, covered by most health insurance. Valley Care Hospital officials say their spine surgeons will now be using infused BMP in place of the old procedure for those who qualify, and that phone calls from those interested have already begun pouring in. In Pleasanton, I'm Christy Schmaltz for the 580-680 News.